Alrighty, it looks like we are right at 4, so we will get started. Hopefully everybody can see the PowerPoint that's on the screen now. Just a couple of housekeeping tips. If you haven't been on with us in the previous weeks, there is a chat box. So just so you guys know, you're currently muted, just so that way we don't have any background noise. But if you want to come off mute and if you have a question or a comment, please let me know and I'll be able to unmute you and we can have some dialogue. But you can feel free to type into the chat box if you have any specific questions that you want us to answer and make sure that we get to those today. But if not, we will get started. Welcome, Lenise. Thanks for using the chat box. So I do see we have a couple of names on here that I have not seen before, so I'm just going to do a little introduction about myself. So my name is Alexa Donnelly. I'm the Deputy Executive Director here at PCCS. We've been doing these webinars every week. We were previously doing them at noon, and now we're doing them at 4 to accommodate some of the remote learning that's happening with schools. So hopefully this is a better time for everybody. If for some reason you are not able to attend these or you missed them at some point, we do have them recorded and they are on our YouTube channel. And we also send out an email every week with the content that was reviewed during this and kind of highlights from the week. So hopefully with all of that communication, you won't miss any of it. And we will get started. So we're doing these now every week at 4 p.m. It's not moving, okay. So our objectives of doing these every week are really to go through and make sure that everyone is clear about our current precautions and communication plans as an agency as a whole, any program-specific changes or updates, any frequently asked questions that we notice are happening across departments or throughout the agency that we want to make sure they get answered really consistently, and then any potential expectations that we might have as we move forward through this COVID-19 pandemic that we're in. So PCCS's priorities pre-COVID and during COVID are always the health and safety of our workforce and the people we support, the continuity of supports and services that we provide, the continuity and stability of employment, and the consistent and transparent communication as much as we possibly can. With that being said, about as much as communication as we try to put out there, this is a really fluid and fast changing scenario. So we do understand that there's been some confusion about what OPWDD has been putting out versus the theories of what they will put out. So hopefully we can clarify that. There is a webinar coming out from OPWDD this Thursday. So please visit the Community of Practice webpage to register for that, but hopefully we'll answer any questions next week with more information from them. So just a reminder to everyone that's joining us, please make sure that you're sharing this widely with people we support, families, employees. This weekly update meeting is really open to everyone and anyone to make sure that everyone is on the same page and we're giving out the same information. So it's not just for administrative employees, and we want to make sure that we really drive that home. So the first thing that we want to go over today is really clarifying what personal protective equipment is. We heard back from some of our direct support professionals through our SurveyMonkey survey about our remote operations that they were unsure if they had PPE or not. So I want to just make sure everyone knows what that is and knows how to get it if you are in need of it. So PPE stands for personal protective equipment. Some examples of PPE are surgical mask, gloves, goggles, surgical gowns, N95 masks, hand sanitizer and hygiene products, face coverings, but just as note that face coverings are not medical grade PPE, neither is a reusable cloth mask, or although they are allowable by the city, they are not medical grade equipment. So if you are treating someone that is COVID positive, you want to make sure to be in touch with us so you have the appropriate PPE for that scenario. So one of the questions we got was, do I have to wear all of this type of PPE every time I work? And the answer is no. The PPE that you are supposed to be wearing at this point for when you're doing direct services or just as a community member out in the world should be a cloth mask or face covering or a surgical mask. The only time that you would wear goggles or a face shield or a surgical gown is when you're treating someone that's COVID positive. So if anyone is in need of any personal protective equipment, please feel free to reach out to your program contact. That might be your FI coordinator, it might be your supervisor, whoever you contact with the agency. And if for some reason you're not sure who to contact, please feel free to email us at covidquestions@pccsny.org, and we'll make sure that you get the PPE that you need. So another kind of large update that we want to make sure everyone is aware of, we are sending out communication to move forward with doing ACH payments, also known as direct deposit. We understand that the mail has been taking a lot longer than usual, and we want to make sure we can get everyone their reimbursements and the checks that they need in a timely fashion. So if you're an employee with us, please go into Paycom and sign up for direct deposit. It will make getting your paycheck a lot smoother and faster for you guys. And then if you are a vendor with us or a parent or a person we support that gets reimbursements, you will be seeing these forms coming out soon. And you can fill that out and get it back to us, and it has instructions on the form with how to do that. We are hoping that this can go live as soon as next month. So just so that way everyone's aware of that, you'll be seeing those. We did have a question come in, a service related question. So the question was, can I have 2 staff at the same time, one doing direct service and one doing non-face-to-face services like food shopping or maybe picking up medication or whatever you might need? Unfortunately, that can't happen because it's technically billing the same exact service at the same exact time. So what we would recommend is having the 2 staff do those 2 services at 2 different times. So if you're getting direct face-to-face service, 8 a.m. to 2 p.m., let the non-face-to-face service start at 2 p.m. after the direct service ends. Because unfortunately that would be what's considered in the billing world double dipping. We will be sharing in this week's email with everybody Cuomo's plan for reopening. We want to make sure everyone has access to that document. And we really wanted to highlight something that was in there, that New Yorkers have access to mental health services, and frontline workers in need of emotional support. There is a text number and access to free meditation and mindfulness resources at Headspace. I use Headspace myself. It's really helpful. It's helped me sort of ease a lot of my anxieties. So I do want to share that. I hope that you guys find that useful. He did also mention in the plan that all frontline essential workers have access to free mental health services. So that means that your co-pays should be being waived if you are getting any sort of therapeutic services. And if you're not, I would reach out to the city and make sure that you can get those reimbursed, because you are considered a frontline essential worker. The next 2 slides are just some information we wanted to share on some other agencies and provider associations that are doing trainings. So this one is from the New York Association for Psychiatric Rehab Services, and they have 2 webinars. 3 webinars. One is tomorrow, then another one is May 21st, another one May 27th. They are Self-Care in the Rise of the Pandemic, Self-Care in the Rise of the Pandemic Part 2, which will focus more on teaching mindful self-care at a distance. And May 27th is Providing Employment Services in a Virtual World. So the links to sign up for those are right here, but we'll also be sending that out in this week's email blast. And if you want to just visit their website, it's www.nyaprs.org. And you can register from there. I do believe that you get continuing education credits for if you're a licensed mental health counselor or a licensed social worker, an LMSW or an LCSW. But this is also open to parents, families, people we support. So we encourage you guys to utilize some of these. They're really great free resources. This is another resource that came out. This is from the University of Albany. They have a training sector, and they are doing professional development and parent seminars that are being offered online. So there's 2 parts to this, and you can register here as well. Their main focus here is improving the flexibility and motivation of students with autism, addressing repetitive and restrictive behaviors and interest in the classroom and beyond. So if that's something you guys are interested in or makes sense for you to take to get further education for the person you're supporting, we hope that you do that. We did want to share some self-direction updates. We did hear from a lot of families that they were concerned about the JCC classes not being reimbursable anymore. And we did hear from the JCC that that has since been worked out between the JCC and OPWDD. So here's a sample of what the letter looks like that was sent out from Timothy Esposito. But feel free to reach out to the JCC. This is something that has been worked out. So hopefully that eases some of the concerns that we had around that. And just kind of openly as a blanket statement, this is not an endorsement for any of the services at the JCC. It was just something that a lot of families had been asking about, so we wanted to make sure we shared the resource. But a lot of the community classes that people receive through self-direction or just community classes that they attend in general have gone virtual. So just check out with your community class vendor what that looks like. Just a couple of reminders, we do still have the poetry contest going on. The end date for submitting your poem, which I really have to get on, is May 15th, so I only have 2 days left. But you do get a gift card for winning. First place is $75, second place is $50, and third place is $25. So hopefully you guys engage with us in that. That'll be fun. I keep sharing this every week, but just in case you guys have not heard of it yet, we were able to work with our insurance company to get free digital exercise classes. So you can sign up here for free, and we'll make sure to keep sending that out every week. So if anyone needs that, they can feel free to register. And that can be something that you use on your own personal time. You can utilize it with the person you support. One thing that we've heard from the medical field during all of what's been going on with COVID is that it's really important to stay physically active. It keeps your lungs expanded in a really healthy way. So we want to make sure that we're encouraging that as much as possible for ourselves and for the people and families that we're supporting. One of the advocacy efforts that we just want to remind everybody about, we are doing a Day in the Life campaign. So that is a photography campaign that we have worked with. I believe her name is Megan Crapanzano. Hopefully I'm pronouncing that right. And she's working with Kevin Roman to really capture in photographs what a day in the life of a variety of different roles and positions look like here and how we support people. So please reach out to Kevin if you're interested in that project. It's really important right now that if we want to be included in different legislative packages and considered healthcare workers, that we have a really strong visual presence out in the community. So please take advantage of that. This we went over last week, but I just want to put this here again. We are in the process of redoing our strategic plan, and we need your guys' help in order to really understand what you feel like our strengths, weaknesses, opportunities, and threats are. So this is a form that was sent out. Several people did send it back. If you did not get a chance to send it back yet, we have added it to the survey that we sent out, so you can actually just do it now right through there. Or you can still use that form, whatever feels comfortable for you. But it is right in the SurveyMonkey link. So we are in the process of preparing to reimagine what PCCS will look like post-COVID-19 pandemic operations. So we want to really make sure that we hear from you guys. We have sent this link out. I want to thank everybody that has responded. We've gotten over 200 responses so far. We still have a long way to go in terms of hearing from everybody, but we do hope that you have gotten that communication, whether it's via email or text message or the internal notification through Avero. Please make sure that you guys are filling that out. We want to make sure anything we do put in place, that we are still hearing you guys and meeting the needs that you have. That is kind of all that we have for today. It was a bit brief. If anyone has any questions, feel free to type them into the chat box. But if not, I'm going to leave us on this positive note. We are all powering through this the best we can, and we'll continue to stand together, work together, and be there for one another. And I wanted to share this quote from Helen Keller: "Although the world is full of suffering, it is also full of overcoming it." I thought that was really inspiring. I saw that from another colleague of ours posted on Facebook, so I wanted to share it with everybody. Oh, yes, no problem. We will send the survey again through email. We'll send that out again this week. You got it. And if it's easier, as long as your contact information is updated in Avero, you will also be getting it from there. You can get it as a text message as well. Hopefully that helps. Perfect. So I'll just stay on for another minute if anybody has any questions, but you guys can feel free to log off if there's nothing else. Thank you so much for taking the time. I know that today was brief, but hopefully we have a bit more information next week. Thank you so much, Belinda. I hope you is as well. Thank you, guys. Thanks for using the chat box. I miss you all.